Hi, I'm Dr. Ron Krzyka, and today's topic is asthma. Did you know that asthma affects about 6 out of 100 children in the United States? And actually, some children with asthma can have mild disease in which they just have intermittent attacks of wheezing and shortness of breath and a cough. Or some children may have some more severe cases in which they have asthma and a little bit of trouble breathing or wheezing that persists for most times of the year. But let's talk about the key things you need to know about asthma. Some of the things that can cause an asthma attack include things like dust mites, strong odors, changes in temperature, exercise, smoking, pollution. These are all things that can irritate the lungs of an asthmatic child and cause them to have an asthmatic attack. One of the key things you need to know as a parent is making sure that your child does a peak flow meter to measure how difficult their breathing is in case they have an asthma attack. A peak flow meter, as shown in this photo, is a device in which child blows air into the device, and this gives the child a reading of their airflow of being able to push out air. This is measured in liters per minute, and a child should know what their personal best peak flow reading is. So if a child's peak flow reading is, let's say, 200, and if that's their best peak flow, and today they have an asthma attack and they're only blowing a peak flow of 100, they're only at 50% of their best peak flow. So that actually puts them in what's called a red zone. The red zone is 50% of their best peak flow, the yellow zone is 50 to 80%, and the green zone is 80% or more. So keep in mind what your child's best peak flow is and know what their red, yellow, and green zones are. And that way you'll be able to check if they do have an asthma attack, how severe the attack is. Now, some of the other things that are important are the medications used for asthma. They include inhaler medicines, which are called bronchodilator medicines, and also medications such as steroids, which actually help decrease the inflammation in the airways of asthmatic children. And most of the time, steroids are used short term, and sometimes we can use the steroids as an inhaler medication for the child. So keep in mind asthma and the causes of asthma, and try to avoid things such as exposing that child to any smoke or dust or things like that. Know the treatment for asthma and know your child's best peak flow and what their red, yellow, and green zones are. Thank you. My name is Dr. Ron Krzyka.